morning, viewers. Today we're talking about creeping. Creeping is a term that we have been taught in our physio degrees, which is basically talking about how the muscle responds to how it's being held or treated. So let's explain it like this. When you have a ballerina that's learning to do the split, she needs to gradually creep the muscles into a lengthened position, which will take a couple of months of stretching on a regular basis until she can do the split. And it doesn't happen overnight. But what happens in chronic pain patients is if you've had an injury, you get creeping in the wrong direction. So your muscles shorten, which causes pain in your neck, in your lower back, in your hips, in the areas that have reduced range of movement. So it is very important, for instance, with the neck, if you're looking down, that your chin easily touches your chest with the body in an upright position, which means that you've got full range of movement of your neck. If you've got creeping in the wrong direction, you will look down and you'll have 3 fingers short or 4 fingers short or 2 fingers short or 1 finger short, but you will not be able to get your chin onto your chest, which means that you've got creeping. The muscles have shortened in the back of your neck, which then causes headaches, neck pain, pins and needles down the arm. So if you then focused on doing stretches, leaning forward, stretching your head down, don't bounce the stretch, take it down, hold it in that position for 30 counts, and you can repeat the stretch every 2 hours. Now with myself that has full range of movement, I would take it into the stretch until I feel the stretching there, hold it for 30 counts, and then release it. You would repeat this stretch every 2 hours in the area that is affected. So if you've got anterior knee pain and you cannot fully put your ankle onto your buttock when your leg is standing straight, then that means that you've got a shortened thigh. You need to stretch that muscle up all the time, so doing a quad stretch until you have full range of movement of that quads. In other words, you're creeping the muscle into a lengthened position and it's not creeping shorter and shorter. It's that shortness, the creeping in the wrong direction, that causes the pain. So again, with your shoulder range of movement, if you need full range of movement, you would do exercises every 2 hours, hold for 30 seconds until you get creeping into the full range of movement. The key here is the every 2 hours. If you're going to stretch regularly during the day, you may sleep at night, but you stretch regularly during the day to creep it into the correct direction. Otherwise, you will never get that area pain-free. And when you have a reduced range of movement, it causes pressure on your joints. So it will cause pressure in the shoulder, it will cause pressure in the neck, pressure in the lower back, pressure in the hips, pressure in the knee. And what this pressure does is it causes in the vertebra, it causes pressure on your disc lesions, which then starts pressing the disc out, and that's when you get a narrowing of the disc space with disc lesions and then compromising of the nerves down the arms and the legs. If it is in the knee joint, you can get degeneration of your knee joint, same in the hip, degeneration of the hip joint, and if left for long periods of time can result in osteoporosis, and later you could land up with getting knee replacements, hip replacements, neck and back surgery because of the compromising of the disc lesion. So once again, it's all about correct posture, making sure that you've got full range of movement of your joints in all areas of your body. If you've had, for instance, a calf surgery, I had a patient who'd torn off his calf and he'd had that reattached onto the bottom of his leg, and he didn't have full range of movement, and for 15 years he walked with this reduced range of movement. He then came to see me for a neck problem because the lack of movement in his ankle had caused a change in his biomechanics, which had resulted in his neck pain that did not want to respond to treatment. So we gave him an ankle stretch, just a normal calf stretch that one does, and within 4 days he had full range of movement because he did his stretches every 2 hours. He blew a whistle and the whole factory came to a standstill and everybody did their calf stretch. It was very funny. And within 4 days he had full range of movement. His foot pain that he'd had since surgery was gone, and so was his neck pain. Range of movement of every single joint is critical, because if you are missing range of movement in one area, it will influence the entire body. So please make sure your posture is good, make sure you have good full range of movement of all your joints from top to toe, and we can perhaps do a video on what is full range of movement of all the joints. If you are interested, watch this space. We'll consider doing that for you. And if you have any questions or you would like any questions answered, please make sure you drop me a WhatsApp or an email or post on the website so that I can help you answer these questions. Have a good day. Make sure you send these to your friends that are having poor problems and pains and have limited range of movement. Let's get everybody up and moving so that we can have a healthy, happy life. Thank you for watching this channel. I look forward to chatting with you again. Have a great day. Thank you. Bye-bye.